It is not uncommon to find traditional medicines being hawked along the streets of Lagos and at major bus stops in Nigeria, and people buy and consume these drugs daily. Most, if not all, of these drugs are not clinically tested, raising concern from medical professionals. Many do not shy away from the drugs, though others are more cautious about them.
I prefer traditional medicine because we were brought up in that way. And traditional medicines are not like what we see today in Nigeria. Because most of these English medicines today are fake.
When you get to the hospital, things are expensive in the hospital. They will give you drugs and they bill you. But that of traditional, you get it cheaper and it works faster.
I prefer orthodox drugs because it's well processed.
I think both can still go together. I believe their fusion will be very, very effective.
Traditional medicine has a long history in Nigeria, with some healers thought to be witch doctors and ailments thought to be caused by the violation of vows made to the gods.
This place is Nigeria, so you don't tell us more. We are more traditional than what you're talking about. Orthodox is not acceptable here.
Our forefathers, they've been using it and it has been working well for them. Like my father, for instance, he believes in this traditional medicine. That's what he uses.
But medical professionals say taking drugs which have not gone through rigorous clinical testing can have dangerous or even fatal results. Dr. Ayoshanu is the Chief Medical Director of Solid Rock Hospital in Lagos.
Because there are a lot of them out there that will say they can cure virtually every disease under the sun. So they need to be sure of who they are patronizing. Two, there's problem about dosage. They don't have dosage. You just say take 1 cup, and cup varies in sizes. I've known a lot of women that have been victims of the traditional people. They said they can cure fibroid, that is just take this particular concoction, it will make you to stool it out. And there's no way fibroid that is in part of the reproductive system will come out through your anus. There is no alternative to fibroid than surgery.
Other medical professionals say that traditionalists often do not warn their patients about the possible side effects of the drugs they sell. Dr. Olugbenga Fadipe is an internist.
For instance, if we give medication, we can tell you, if you take this medication, expect chest pain, for instance, expect a headache, for instance, but don't worry, after a few days it will go. The patient will be comfortable knowing that when they see those things, the doctor has warned me, he or she will not be alarmed or apprehensive because of it. But there's no such thing for traditional drugs. There are quite a number of conditions that are common in the environment and are caused by prolonged use of herbs. Kidney disease, for instance. If you remove the first two common conditions, diabetes and hypertension, the next thing you take is prolonged use of herbal drugs.
Chief Paul Ojay is the medical director of the Iris Medical Foundation and a well-known traditional medicine practitioner in Lagos. He showed me several drugs he produces, such as one he says cures skin diseases. When I asked to see his laboratory, his aides refused. But Chief Ojay insists his drugs go through clinical processes and are approved by Nigeria's Drug Law Enforcement Agency. He says that his drugs are prescribed by dosage.
But you cannot say that there's no quantification of dosage, because NAFDAC expects you to give dosage of what quantity is the person supposed to take. If you go to the village, whatever you see, take.
So that means you have dosage, right?
Yes, of course. For me, Bonsky said I can talk of the one in my belly, not the one I'm carrying behind.
You have dosage. You don't know about others. That's what you mean.
Yeah, of course, I don't know.
Chief Ojay also says that he is able to cure fibroids.
Infertility everywhere. Very simple something to clear. In 3 months, the biggest fibroid is gone, using our products. Those who want to come and take natural treatment that will remove what they have, they are welcome, including the men who said they say they have low sperm count, male infertility. That's absolute trash. they can get well.
Lagos State government officials are trying to educate Nigerians about their modern medical options.
Our health officers have been going around to educate the public that you don't have to just take drugs indiscriminately. I think the reason for that desperation is because the hospitals are themselves too expensive. The hospitals were not giving them what the satisfaction they want. But our hospitals are better now.
There is the common saying that health is wealth. But medical experts in Nigeria say for Nigerians to attain that, they must be very careful about the type of medical practice they trust. From Lagos, Nigeria, Jacqueline Ogo reporting.